Okay, so it's right on 11 a.m. Welcome, everyone. My name is Chiquita Paula de Souza. I'm one of the education chairs of the American Academy of Pediatrics section on Global Health Executive Committee. I'm pleased to introduce this AAP webinar series, Global Health Practice in the Time of COVID, Finding Effectiveness in Your Personal and Professional World. Our first webinar, Global Child Health During and Beyond COVID-19, A Policy Perspective, co-hosted by the Section on Global Health, UNICEF, and Gavi, will begin shortly with panelist presentations followed by a Q&A. I just want to mention that we do not have any conflicts of interest to disclose and that this webinar will be recorded for those who are not able to attend. Please feel free to submit questions at any time during the presentation and make sure that it's addressed to all panelists so that we can see them and address them at the end. And now I will hand over to Dr. Ojo, my colleague from SGH, who is the Policy and Advocacy Chair, and he will be our moderator for this session and will introduce our panelists. Thanks.
Thank you, Dr. Paula de Souza. Like many of you, I practice pediatrics and I desire to go beyond the confines of my office to improve the lives of children in my local and my global community. We have three distinguished panelists on this webinar today who will provide us with tips to do just that. They will teach us how to extend our influence as physicians and advocates for our young and vulnerable patients who might be unable to speak for themselves. Each of our panelists will present for about 10 minutes in order to provide us with ample time for questions and discussion. Like Dr. Paula de Souza mentioned, we will be using the chat function for your questions and answers, and we invite you and encourage you to submit those questions as we go along. Our first presenter is Ms. Mandy Slotzker. She's the Director of Global Child Health Advocacy at our very own American Academy of Pediatrics. She guides and promotes helpful child health policies in Washington, D.C. through the AAP's Department of Federal Affairs. Thank you, Mandy. Second, we will hear from Gavi, the Vaccine Alliance, an organization dear to my heart. They are doing the important work of building partnerships which make vaccines accessible to children all over the world. Dr. Anta Sinha is Senior Executive Officer to the CEO at Gavi's Executive Office in Switzerland. Thank you for joining us, Anta. Then Dr. Fauzia Shafiq, who is the Senior Health Advisor at leading the Health in Emergencies team at United Nations Children's Fund. She works out of the headquarters in New York. She will complete the presentations with a global view of important child health priorities that cannot be put on hold, even as nations are thankfully on the recovery slope of this pandemic in some regions. And we hope that we would be able to provide you with helpful information as we go along on the seminar today. Thank you all for joining us. Listen intently and type in your questions. Over to you, Ms. Slotzker.
Thank you so much. Hi, everyone. I hope that you're having a nice morning or afternoon or evening, depending on where you are in the world. Wanted to kind of go through this as quickly as possible, just to make as much time as we can for question and answers, because I really think that discussion will be really useful on this topic. So I wanted just to share a bit about the federal advocacy response to the global coronavirus or COVID-19 crisis that's going on. So global health in the time of coronavirus. So some of the things that are really important to do is to support and fund accounts that are at the front line of the response. That includes funding for USAID and CDC to provide direct COVID support in terms of prevention and response. But also, just as important is to continue advocating for the continuity and flexibility for existing child-focused programming. I think we'll probably hear a lot more from UNICEF and Gavi about what's at risk for children around the world with immunizations. I know that there are 80 million children at risk of disease-preventable diseases as a result of some of the immunization campaigns being halted due to COVID-19. And there's many other issues that we kind of don't even think about that are going to be impacted, including child protection. we want to really raise awareness about these unintended consequences of what COVID-19 is having around the world and what it means for kids. And of course, provide guidance to Congress and support legislation. So in terms of legislation, some of the things that I'm working on include annual appropriations process to make sure that Congress appropriates funding to global health accounts within our foreign aid. That's still happening despite everything else that's going on in Congress. We're also continuing to promote the Global Child Thrive Act, which is a bill that would integrate early childhood development interventions into current foreign assistance programming. It's something that a lot of USAID missions have told us that they would like a little more guidance on. So hopefully we can try and get this already passed out of committee on the House side, and we're trying to get it passed out of committee on the Senate side. And then the next step would be to actually get it passed by the full Congress. And then, of course, there's a lot of talk about global health security, given what's been going on. And there's a variety of different pieces of legislation that the AAP has endorsed and is supporting, which includes the Global Health Security Act, which would designate more interagency coordination in law. A lot of you probably heard that there used to be a pandemic response team within the National Security Council, and that John Bolton and President Trump disbanded that. That is true. We think that if that had been around, maybe some of the problems could have been averted. So there's that. There's also this other act that we're trying to authorize funding for CEPI, the Coalition for Epidemic Preparedness and Innovations. CEPI is investing in at least 9 COVID-19 vaccine candidates. The U.S. currently does not contribute to CEPI, and we believe it's really important that we do. One of the things that the AAP has been focused on is not just getting funding for CEPI, but also making sure that CEPI prioritizes to make sure that its COVID-19 vaccine candidates clinical trials include children. We don't want children to be left behind with the COVID-19 vaccine. So it's very important that it is that children are included in the clinical trials. And then there's this Global Health Security and Diplomacy Act, which is kind of a combination of the former two. Happy to go into more details with what these pieces of legislation actually mean if people have questions about it. But we're basically trying to see if we can get the Senate Foreign Relations Committee to come up with some sort of bipartisan legislation that would strengthen kind of the U.S. government response and interagency coordination, be able to strengthen USAID's ability to respond to COVID-19 and future pandemics, and also participate in and authorize funding for CEPI. Those are kind of the big pieces. We're providing programmatic and policy guidance to folks on Capitol Hill. So I regularly talk to staffers who lead on foreign relations and international affairs. Many of them are very focused on what obviously COVID-19 means for them and their constituents. But we also want to think beyond just what this means for coronavirus, but also the impact that it's going to have on early childhood development, on maternal and child survival, on child protection. So an interesting thing on child protection is that, it's a sort of a similar issue to what's happening in the U.S. With kids out of school, there's not as many eyes on children to be able to notice if children are suffering from signs of abuse or trauma. A lot of the resources like social workers and other resources that were a little bit more easy to access prior to the pandemic are now harder to access. So it's very important that we continue to maintain these programs and find new and innovative ways to, get social workers and outreach workers to actually go to children's homes if they're not going to be going to school, things like that. There's, a lot that this means for early childhood development in terms of, kids reaching their developmental milestones and And we want to make sure that all of that still happens. So we're providing kind of key guidance to folks on Capitol Hill about what they should do right now to help the world's children. And so we're telling them a few things. We're telling them that we need additional funding for the frontline response to coronavirus. We need continuity of existing funding and existing programming. So that includes, all the immunization programming, all of the nutrition programming, anything with maternal and child survival. And then we also want to make sure that programs have a little bit more flexibility. So if a program that USAID is running used to do something a certain way, could that money be used differently with coronavirus? Could things be made more mobile? Could they use more technology to provide services instead of in person? Kind of let's allow a little more flexibility. And then we're asking them to support the legislation that we think is needed to support these things, and what I said before. One of the things that we're really worried about is undoing so much progress that's been made over the last few decades in terms of child survival. The rate of children, the number of children who are dying from preventable diseases has been cut by more than half since 1990. And that's due to many things, especially the work of Gavi and UNICEF. And we're really worried that we're going to kind of roll back on the success that's been made, especially around things like measles and polio, which we're at risk for now with kids missing routine vaccination. And then I wanted to talk just kind of at the end about the role of WHO in global child health. So you all know that the WHO, the role it plays is extremely, extremely critical for children and families. And it's at risk now because the current administration has announced both a funding freeze and an intent to withdraw the United States from the WHO. Interestingly enough, just because it was announced doesn't mean it's happening. Donald Trump made the announcement at the end of May, and as of now, no formal request has actually been made to the WHO to have the U.S. withdraw. So in order to start this process, under law, under U.S. law, it would take one full year to do kind of an off-ramp where the U.S. would withdraw. And in order to do it, the U.S. would have to pay funds that it had not paid for the last fiscal year. And so we're not sure exactly how much money that is. It may be around $100 million, but they would have to pay their bill, and it would take about a year to withdraw. If things change, if the administration changes with the election that's coming up in November, this could all kind of go away. Also, there are many U.S. citizens who work at the WHO, and none of them have been told to return to the U.S. So it's very complicated. This has been happening a lot with the administration, where an announcement is made, but no actual action has been taken to follow up what they said they would do. So in terms of next steps, wanted to alert you guys just to some resources. So the AAP publishes advocacy reports. We also have advocacy actions you can take to support both global health issues and other issues affecting pediatricians in the U.S. on the website. And then the UN Foundation has a toolkit on the WHO. And happy to share this out with everyone afterwards. Thank you so much, and happy to answer any questions.
Over to you, Dr. Sinha.
Thank you. Good morning, good afternoon, good evening, depending on which part of the world you're in. Thank you for the opportunity to speak at this event hosted by AAPA I'm Antara Sinha, and I work with Gavi, the Vaccine Alliance. I will be speaking about Gavi's immunization programming during COVID-19, but because there's also a period of transition for the Alliance in terms of transitioning from our previous 5-year strategic period, which spans 2016 to 2020, to our new strategic period from 2021 to 25, I will also speak to some broader relevant issues. For those of you who may not be as familiar with Gavi, Gavi's mission is to save children's lives and protect people's health by increasing equitable access to vaccines in lower-income countries. Gavi was created to address wide inequities between high and lower-income countries in terms of access to life-saving vaccines. The Gavi model leverages key mechanisms such as economies of scale, long-term financing, market shaping, strengthening access to vaccines and vaccine delivery platforms, with a view to helping countries create equitable and sustainable immunization programs. And never has our mission been more relevant than it is now. Gavi has worked in using the various mechanisms that I just referred to make significant impact. The most significant, perhaps, is the efforts to reduce the cost of vaccines. Through Gavi's efforts, the cost to immunize a child with a full course of life-saving vaccines is approximately $27 in Gavi-supported countries, compared to an estimated price of $1,100 in the US for a similar package. The world is facing an unprecedented challenge, which we are all together in. Since January of this year, the global spread of COVID-19 has had a devastating impact on countries around the world. Though the number of COVID-19 reported cases in Gavi-eligible countries accounts for 11% of global cases, what is alarming is that this share has increased by 8% within 1 month. Expectedly, we also observe variability in disease burden between continents and countries and within countries. Economies and livelihoods will take a big hit in Gavi-supported countries. Just a few examples: an estimated 50 million people are likely to be pushed into extreme poverty in 2020. Another 195 million are likely to lose their jobs worldwide. 265 million are likely to face acute food insecurity. The pandemic also has serious gender-based implications in terms of increased risk of domestic violence, limited or no access to essential health services caused by disruption, etc. Bear with me as I'm experiencing some. Now, early results from a recent qualitative pulse survey on essential health services conducted by WHO indicates that countries' immunization services are the most impacted amongst all essential health services. Currently, of a total of 68 Gavi-supported vaccine introductions projected to take place in 2020, 45 introductions have been impacted due to COVID-19. It has been reported that uptake of routine services is reduced. About 18 Gavi-eligible countries have reported vaccine shipment delays. Another 12 countries are reporting stockouts at central or subnational level due to COVID-19. However, the good news is that UNICEF has recently informed us that they're now reporting 42 shipments per week, which is almost back to the pre-crisis baseline. In the previous 6 months, broadly coinciding with the start of the pandemic, there have also been several vaccine-preventable disease outbreaks across Gavi-supported countries. Fragile countries already grappling with weak health systems are particularly hard hit. The Democratic Republic of the Congo, for example, is facing multiple outbreaks of cholera, measles, and most recently, a new outbreak of Ebola in Equator province. The demand for Gavi-supported stockpiles for relevant antigens remains high as countries strive to protect their populations in these challenging times. Our priority is to ensure that the impact of COVID-19 on immunization services does not lead to other outbreaks of preventable diseases, and that missed children are reached after the crisis. Now, Gavi's response to COVID-19 is tied to the following principles. Vaccine preventable disease control is a priority. Equity is an organizing principle with a view to reaching missed communities and leaving no one behind with immunization. Differentiated and tailored responses are required. It is critical to have an integrated approach to recovery. It's equally important to invest in a learning agenda, all with a view to rebuilding better. In terms of Gavi's support response to COVID-19, Gavi has made available $200 million of programmatic support to countries for immediate COVID-19 response and preparedness efforts. This includes reprogramming applications for health system strengthening, partner engagement framework, targeted country assistance, and post-transition support for immediate preparedness. So far, we have approved more than 50 COVID-19 related requests from countries with a combined value of $75 million. Gavi's largest area of support continues to be infection prevention and control. It accounts for almost 54% of the total support provided so far. The above interventions are accompanied by flexibilities in Gavi's core policies, including eligibility and transition policy and our co-financing policy. Gavi has ensured nimble approval processes. For example, we have a quick 5-day turnaround of country requests. We are also working with alliance partners and countries to repurpose on-the-ground partner support. On a positive note, there are also some very encouraging reports of countries to maintain immunization services despite ongoing challenges. For example, Lao PDR successfully introduced HPV vaccines, with provinces reporting more than 70% coverage. The Pakistan government's efforts in Sindh province to provide PPE to vaccinators and incentives to health workers led to an increase in immunization coverage. Similarly, the personal shuttles provided by the government of Uganda to ferry people to and from routine immunization sessions was also extremely impactful. Gavi is at the forefront of ensuring equitable access to COVID-19 vaccines. In late April, the Access to COVID-19 Tools or ACT Accelerator was launched by WHO with leadership by the EC and many others. It is envisaged as the global coordination mechanism to accelerate the development and equitable access to COVID-19 diagnostics, therapeutics, and vaccines. Gavi and the Coalition for Epidemic Preparedness Innovations, CEPI, that my colleague just referred to, were asked to co-lead the vaccine pillar, working closely with the WHO. Within the vaccine pillar, Gavi is leading on procurement and delivery at scale, leveraging almost 2 decades of domain expertise in the area. On 4th of June, the ACT Accelerator announced the COVID-19 Global Vaccine Access Facility, or COVAX facility. It is a global mechanism aimed at ensuring equitable access to COVID-19 vaccines for all countries. As an element of the facility, the Gavi Advanced Market Commitment for COVID-19 vaccines will serve as a financing instrument aimed at supporting access to vaccines for developing countries. And this is a very high-level overview, and I'm happy to discuss it further should you have questions. But as you can understand, these are early stage discussions and a lot of the details are still being worked out. Now, Gavi, the Vaccine Alliance, has always been driven by equity. And as we look forward to our next strategic period from 2021 to 25, equity remains the organizing principle with a strong focus on zero-dose children and missed communities. All Gavi 5.0 work streams are closely aligned to the central theme of zero-dose children. However, there are expected to be delays on operationalization of some of these work streams due to the COVID-19 pandemic. On the 4th of June, the government of the United Kingdom hosted Gavi's Global Vaccine Summit 2020. Among other pledges, the Alliance secured an additional $8.8 billion raised for Gavi's next strategic period. And this was in addition to some assured resources that led to a grand total of $10.5 billion US. All of this work that we are doing now will enable us to immunize a further 300 million children with the largest portfolio of vaccines ever, saving 7 to 8 million additional lives. It will strengthen health and immunization systems and reach zero-dose children. After all, vaccines don't deliver themselves. It will also enable Gavi to strengthen global health security and epidemic prevention and control. Gavi will be able to continue investing in stockpiles of diseases against epidemic potential, such as Ebola, yellow fever, meningitis, measles, and cholera. The successful replenishment of Gavi, the Vaccine Alliance, thanks to the support of very powerful groups such as yourselves, marks the continuation of our common mission to save people's lives, contributing to people and countries' prosperity, and to make sure that no one is left behind with immunization. Thank you.
Thank you very much, Dr. Sinha. We will pass it on to Dr. Shafiq to continue the presentation from UNICEF's perspective. Dr. Shafiq, you're on mute.
Hi, everyone. Good morning, good afternoon, good evening, everyone. I hope you're all doing well and are being responsible and are staying safe. I'm very happy to be joining all of you this morning. And as the title of my slide says, I'm going to briefly talk about UNICEF's global response to COVID-19 and speak of a few of our priority areas of work. So to begin with, UNICEF, so of course, our response is built around children. And amongst children, our concern is highest for children who are vulnerable. Now, while the vulnerable children can be anywhere in the world, in the least developed to the most developed countries, unfortunately, very often they are located in places that are conflict affected, that are fragile or vulnerable, or facing various humanitarian disasters. And so in our programming, we try and focus on these children because the national or the local authorities that are responsible for the care of these children very often do not have the capacities to be able to address their needs on their own. And in many cases, as a previous presenter also said, they're facing multiple other challenges as well. There's Ebola in DRC, there's conflict in Yemen, there are huge displaced populations in Somalia. And so these vulnerable places very often are not only having to deal with the pandemic, but pre-existing crises as well. In terms of our strategic priorities, they align with the global strategic response plan for COVID-19. That is a UN-wide plan led by WHO. So the two strategic priorities, the first one, the obvious one, is around addressing the transmission of the virus and case management so as to reduce the mortality from the COVID-19 disease. The second pillar is a broader pillar that is around mitigating the secondary impact, the socioeconomic impact of COVID-19 pandemic and the mitigating measures that governments have had to take, such as the lockdown measures, and their effect on various social services. Now, while the first pillar, of course, also requires multiple sectors to come together, it's the second pillar that requires that all the various sectors come together and work. For UNICEF, that means our health, water and sanitation colleagues, education team, nutrition, child protection, and even the social protection colleagues coming together to work in the interest of the child and not deal with it as a health problem alone. But as I already mentioned, our concern is the vulnerable children, and therefore in UNICEF, we have what we call the cross-cutting teams, which are the teams that focus on particularly vulnerable subgroups amongst these children. So there are teams, so we work on children on the move, children with disabilities, the most vulnerable adolescents, the urban poor, the girl child, and so on. So the second pillar is managed by multiple teams across multiple sectors. Now, to maybe focus a little bit more on the health strategy itself. The way UNICEF is looking at the health strategy is ours is a three-pronged strategy. The first one is the same as the pillar one that I just mentioned, which is stopping transmission of the virus and managing cases to reduce mortality. Now, within this area of work, the sectors that are most involved are the health and water and sanitation sectors that work around infection prevention and control. Then there is the community engagement and community awareness team, and then the work on case management. Now, most of this work we do, of course, very closely with WHO and other partners. So when we work on things around pediatric case management or referral of children from one level to another or from one kind of service to another, such as a severely malnourished child to be moved from a TCF or a stabilization center to another ward where COVID cases are being handled. So those kind of details. And then, of course, things like breastfeeding and complementary feeding in children who might have, who might be suffering from COVID-19. The second pillar, and perhaps the one that has us most worried, is the one around maintaining essential life services, life-saving health services for mothers, newborns, and children. Now, the first presenter mentioned, Dr. Slutska mentioned some of the key figures around what the world may have to face in the coming months if we don't ensure that regular health services continue. I'd just like to add to that. I'm sure most of you have seen the figures that the Johns Hopkins University published after the analysis that they're using the LIST tool, which shows that in the best case scenario, with the current rates of disruption in health services that we are seeing, we will see an additional 250,000 plus deaths in children under 5, and at least 12,000 additional mothers will have lost their lives because of disruption in services. However, if we do not take immediate steps to make sure that the regular services continue, in the worst case scenario, the additional under 5 deaths could be upwards of 1 million, and additional maternal deaths could be upwards of 55,000. And so that's why the second area of work concerns UNICEF the most. The Global Malaria Partnership has also done some analysis that shows that if the distribution plans for long-lasting insecticide nets are disrupted and the current plans for early diagnosis and treatment are disrupted, we will be at the risk of losing gains, the progress made over the last 2 decades. Now, that's a frightening thought. Then the third pillar, which is very closely linked to the second one, is that we want to make sure that the very significant resources that are being made available to the low and middle income countries to address the pandemic are used in the best possible way, so that they are not only useful now, but they also help us in future in addressing causes of child mortality. And I'll speak a little bit on that a little later. Now, I'm not going to read through all of this, but you will have slides, so I hope you'll take a few minutes and read through them later. But just to make 2 points on monitoring, we have realized that we are very well equipped to report on what we are doing. Number of people we've trained, the kind of supplies that have gone in, the amount of funds that have been dispersed, and that kind of thing. But unfortunately, despite the last 2 decades work on health management information systems and the inputs that have been made, for example, from moving from a paper-based system to a web-based system, the DHIS2 work that has been done. We have found that, unfortunately, there's hardly any country amongst the low-income countries that can report on the disruption in health services with any certainty. So we are not able, that is why we are having to rely so much on modeling, is because the current reports coming out of the health system just are not able to tell us, for example, how many health facilities are no longer functional, or the pediatric OPD consultations have gone down by a certain number. And that's something that we are trying to address so that in future emergencies, we don't find ourselves working with estimates rather than actual figures coming from the field. And that is another reason you're seeing a flurry of surveys being done by various partners to try and get a sense of what's actually happening in the field. Now, very briefly, and I'm again not going to go through the detail of this, there is an internal monitoring mechanism that we have in place in UNICEF whereby the country officers self-report. And I just wanted to draw your attention to the top 3 interventions that are presented as the ones that are most disrupted. It's the outpatient care for children, it's the community-based service delivery for mothers and children, and it's immunization. And this is worrying because this means that not only are services not available at the health facilities, they're also not available in communities. And then if you look at the reasons of why these services are disrupted, A is there's a drop in utilization because people are just afraid to come to the health facilities for fear of COVID. The second is that because of the lockdown measures, there are issues with people being able to move and transportation constraints. And then there are certain health facilities that are closed or health services that have been suspended. This is based on, and our Gavi colleagues know very well about it, there's a pulse survey that is being conducted globally by the immunization partners, WHO, UNICEF, Gavi, and several others together. I personally feel, and I hope our Gavi colleagues would agree, that globally, this is probably the most sound data that we have that tells us about what kind of services are disrupted and for what reasons. And it speaks to the very good collaboration that our immunization colleagues have amongst themselves, but also at the country level. Now, what are we doing in terms of making sure that the services continue? First is, of course, to prioritize which are the services that must continue. In many of these settings that we are working, governments have to make very difficult decisions and cannot make sure that all services continue. So some tough decisions have to be made. And there were earlier on some guidelines given on the services that could be safely interrupted for a week or 2 or 4 weeks if needed. But then there were those that could not be disrupted at all. So, immunization, for example, if you have a campaign, it could be safely postponed. If routine immunization needs to be suspended for a couple of weeks, not longer, can be done. But things like essential newborn care, things like care for severe cases of pneumonia or delivery care are things that cannot be interrupted even for a couple of days without there being threat of loss of life. The second thing that we're trying to do is working country by country on a context-based approach to changing strategies so that the services can continue. In some places, health facilities have been assigned COVID, non-COVID, community health workers. There's been task shifting done so that they can take on additional responsibilities when the health facilities are not able to take on additional patients, targeted outreach or mobile teams going to certain places. And surprisingly, even in many of the low-income settings, a lot of reliance on telemedicine. And then, of course, making sure that people are able to come and receive services safely. So within health facilities, making sure there are strong infection prevention and control measures in place, screening is being done, triage is done, COVID and non-COVID patients are separated so that other health services can be delivered in a safer manner. And then, of course, finally, making sure that there is trust between population that is being served and the service providers. It's very sad to see that while in many countries around the world, health workers, the frontline health workers are being celebrated and appreciated for the work they are doing, and very rightly so. There are other countries where health workers are being attacked on a daily basis because they are seen to be either part of a conspiracy theory that is going around, or there are rumors that they are not doing all that they can and that they're hiding information from families. So there's really need for work to protect these health workers to the extent possible. And then finally, I wanted to talk briefly about the final pillar, which is around making sure that the current investments have longer term impact also. And so without, again, going into the details, we're looking at how the current funding that is available, and a lot of it is flexible funding, can be used by ministries of health in the middle and low income settings to make sure that it goes into strengthening the human resources for health, building institutional capacity, ensuring that they are better prepared for future emergencies, that the task shifting that they do now are things that can feed into future emergency preparedness plans as well. And so what we've been doing at UNICEF is that we're working very closely with the bilateral donors, but also with the IFIs to make sure that our vision of best utilization of these funding opportunities align. And so we've been working with national governments and ministries of health to make sure that these resources are being used in most optimal ways. And so there I would like to give you just two examples before I end. One is the support to oxygen therapy. We all are aware of pneumonia still being one of the largest killers of children in many of these settings. Some 800,000 children losing their lives every year to severe pneumonia. And many of these lives could be saved if there's optimal therapy available at the district and sub-district level in these low-income settings. So one of the things that UNICEF is championing is using the opportunity. I don't know if opportunity is the right word in such a grave situation, but the opportunity that these funds provide to make sure that medical oxygen is available for the COVID cases, but also for any future cases of severe respiratory illnesses. So we are working with countries not only to make sure that there are, for example, oxygen concentrators available, but also making sure that the health workers are adequately trained in the protocols for use, that there is capacity within countries for installation, maintenance, and repair of these equipment. Another similar thing that we are working on is wash and health facilities. There are only there's 1 out of every 8 health centers does not have running water, and 1 out of 5 health facilities in these settings do not have sanitation facilities. And we all know how important these are for quality of care, especially when it comes to maternal and newborn health. And so we're also using the opportunity provided by the funding that is coming in for COVID to make sure that the IPC measures that we are taking have a strong wash component, and that we leave these health facilities with proper water and sanitation facilities that will not only help now, but in future as well. And then another area, I'm just using this as an example. There are several other examples as well. And this is using digital health platforms for training of health workers, for keeping in touch with health workers to keep their morale high, to checking in on them when they fall sick and are no longer able to report to duty, for communicating with the communities. And by communication, I mean being able to send them messages and receiving feedback from communities. So we have around 5 million people who have in the last 2 months using chat bots in various countries communicated with health authorities about their concerns and received feedback in return. And then, of course, also using these platforms for monitoring of disruption of health services, so that the community health workers and health facility in charges can come back and tell us, my facility is not able to function because of X, Y, and Z, so that action can be taken. And I will stop here, and I'm happy to answer any questions that you may have. Thank you.
Thank you again, Dr. Fauziya. Thank you to all of the participants that have joined us on this webinar. It's been very insightful for me, and I'm sure you all have questions, and you would do well to just type those questions in the question and answer box on the right side of your screen, and we would be addressing those questions to the panelists. If all the panelists can turn on their cameras, which we all do have now, that's helpful. And we would start with some questions that I have for the panelists this morning. Thank you again, Mandy, for your presentation. I was wondering if it's possible for us to leverage influences and personal relationships that pediatricians might have with their state legislatures to make an influence on these federal advocacy issues that you've mentioned, or do we do better by just directing our efforts at the senators and the representatives at the federal level?
I would say that it would make more sense to direct your energy to the federal level. I think it's wonderful to have relationships at the state level, but leveraging those relationships should be more focused on what the state has the power and the ability to do. So the state budget, the state response, all of our work, all of the work in terms of foreign affairs is done at the federal level. So anything around the U.S. response in terms of funding and in terms of laws passed around what we can do on global health, that comes from the federal level. So I would say that's where the action and that's where you should focus the advocacy effort.
Thank you, Mandy. We have a question about the reopening of schools, which any of you can jump in on. It says, what, if anything, is being done to ensure safe reopening of schools, and also in thinking about health services that were provided in schools that have been interrupted? I know in some countries, vaccination is being delivered through the school system, and there's also essential nutrition services through the school feeding programs. So if any of you can comment about how you're working with governments to look at how schools can be reopened safely, that would be helpful.
Sure, I'm happy to come in with a couple of remarks. Can you hear me? So there was an, I think 3 days ago, there was an op-ed by UNICEF Executive Director, Edie Fore, where she strongly advocated for reopening of schools, at least based on all the evidence that we have so far. So I think we have now 6 country-based studies that show that children are not the primary source of, or were not the primary source of infection within families that did have COVID-19. There are a couple of studies that are close to being published that show a slightly higher rate of transmission from kids to adults than the 6 studies that are already being quoted. So we are being very, you have to be, we're being cautious in making any recommendations to countries. So what we, at least as UNICEF, WHO, and other partners have done is that we are not making recommendations to countries on whether to close or open the schools, but to say that provided you are able to take these steps, it's better to have the schools open rather than closed. And this includes, of course, guidance on being able to practice some level of social distancing when the children are in schools, being able to provide some basic hand hygiene supplies to countries, making sure that the teachers are protected as well. And also making a case that children are likely to suffer more if they're not in school than they are from the disease itself, even if they are to go to school. So there's some modeling work going on for a few countries to look at if the schools were to reopen and were only able to implement minimum levels of social distancing and IPC, what are the likely numbers that we will see in terms of infections in children? And given the current rates of transmission from children to adults, what are the likely number of cases that we would see in adults? And is that a risk that that particular country is willing to take in the current circumstances?
Thank you, Dr. Shafiq. That's very helpful and detailed. I think it requires a very thoughtful approach and very individualizing the context of the different economies and the countries that have to make the decisions and what is possible. There's a question about chloroquine and the fact that ongoing trials have not confirmed the initial promise of efficacy of antimalarials in general in COVID-19. You say that it is not currently recommended, and I believe that's rightfully spoken. I don't know if you want to make any more comments on that.
I think that's the latest that we have, all of us, that's accurate. But there is, WHO is certainly working on studying it further. So no final conclusions, but at the moment it is as you summarized.
Thank you, Dr. Shafiq. A question for Gavi. What about catch-up vaccines for children over 5 years who did not receive vaccines in the first 5 years? we struggle to access vaccines beyond tetanus for children greater than 5 years from protected communities in a boarding school in Uttarakhand, India.
So if I understood the question correctly, the context is in Uttarakhand state in India, and the question is about children above the age of 5 who may have missed out on some critical life-saving vaccines until that age. So what are the strategies around it? If that is the question, well, there are going to be, especially in the context of COVID, there are going to be very targeted efforts to have catch-up campaigns, to organize series, to ensure that children, even beyond the age of 5, are included in the net. Now, again, a very differentiated and tailored approach is required to ensure that the state-level governments or national governments in various countries, depending on how health is structured within the country, approach this. But Gavi is certainly, as part of the recovery mechanism, going to encourage countries to try and target missed children to whatever extent possible. The objective being that you generally improve the health of the population and including older age groups if required.
Thank you, Dr. Sinha. That's very helpful. There's a question about the work on oxygen concentrators that some pediatricians and engineers in Canada and Benin Republic in West Africa have worked for 4 years on a program to improve the maintenance of these oxygen concentrators. Are there any funds available to support these initiatives?
There's a global coalition. I'm sure you're aware of it. Every breath counts, and it brings together the UN agencies, the international NGOs, and national NGOs, a lot of national governments, ministries of health together as well. And part of its mandate is also resource mobilization for various aspects of tackling pneumonia. I'm happy to put in whoever's interested. I'd be happy to make the connection not only with the coalition but with the colleagues in our own team that are working on this. So the 16,000 oxygen concentrators that I mentioned are being delivered to 89 countries. But I mentioned the concentrators because there tends to be a lot more interest in supplies and other things. In these 89 countries plus several others, we're also working on what we call the soft component. Making sure that the health officials are trained in the required protocols, but the maintenance staff is able to repair and maintain these supplies and so on. So if I'm happy to make the connection, and I'm sure some help could be found.
Thank you, Dr. We have a question directed at the fact that in the U.S., discussion about COVID are often intertwined with politics and political affiliations. We're wondering if Ms. Lotsker can comment on how we can keep the focus on public health issues rather than politics.
Yeah, it's unfortunate that the situation with the WHO has become so political. I think it's really important to focus on the messaging, which is that we really care about children and we want children to do well. And in order for that to happen, we need to make sure that we continue to fund programs and services that support children and their families around the world. And so that means continuing to fund USAID, UNICEF, Gavi, all of these important things. If possible, I think steering clear of the WHO is sometimes helpful, just because it is kind of a lightning rod at the moment. But one of the things is just continuing. There is still a lot of support for maternal and child health on Capitol Hill and by our elected officials. And so I think it's just about kind of pivoting and focusing the conversation on what's needed and not focusing on all of the mechanisms of how to achieve it, if that's helpful. I did see a question specifically from the DRC and how developing countries can address like with fewer resources. One thing to note is there is a pandemic emergency response fund. It's called the Pandemic Emergency Financing Facility at the World Bank. So countries that are eligible for IDA loans can apply for either cash transfers or loans at a very low rate to respond to pandemics. This was established in 2016 in response to the Ebola outbreaks in West Africa, but the Democratic Republic of the Congo has used some of this funding in 2018 and 2019 to address Ebola in the DRC. And so I believe that $195 million has gone out to 64 of the world's poorest countries that have COVID. From the World Bank, obviously more needs to happen to find ways to have kind of immediate cash going to these countries to immediately address pandemics when they emerge, and also to prepare for the future pandemics. But one thing that we've noticed, and that I think everyone probably knows, is it's really hard to get countries, including the U.S., to invest in pandemics, because up until recently, we haven't had a major one impact us. And so it's hard to invest in something that's kind of in the future, as opposed to something that's happening at the moment. And so I think this will be kind of a reminder for countries, including the U.S., that we need to all do our best to prepare for these outbreaks and to make sure that we really finance our health systems. But yeah, there's a lot more that needs to be done in order to make sure that funding is readily available.
Thank you so much, Ms. Slutzker. One last question for Gavi and then UNICEF. There is a question from one of our participants that during the pandemic, vaccines can't simply be sold to the highest bidder. They should be available and affordable for people who are at the heart of the outbreak and in greatest need, like in my country, Nepal. How do we ensure equity?
So I think, as I've mentioned already in my presentation, equity is the key organizing principle for Gavi. It always has been, ever since inception in 2000, and it continues to be the central theme that cuts across all our 5-year strategic periods. Even in the context of the COVID-19 vaccine, WHO is working very closely with all its partners, including CEPI, Gavi, and other partners, to ensure that equity is considered across the board. The allocation mechanism being developed by WHO is a very transparent process. It's being developed in a consultative manner, and therefore should take into account a lot of the important factors that you have mentioned. At Gavi's end, with regard to procurement and delivery of a future COVID vaccine when it is available, will again be determined by the needs of the countries, prioritizing obviously lower income countries that may not have the resources. As you have correctly mentioned, and as my fellow speaker Mandy also mentioned, this space is a fairly political space, but the idea is to try and keep health of human beings and saving lives at the center of all discussions. And therefore, equity remains the fulcrum of all discussions.
Thank you very much, Dr. Sinha. Final question for UNICEF as we wrap up is about any work or resources available for child resiliency and recovery in the setting of how COVID-19 has significantly impacted mental health through all the drastic changes that children have experienced in their schools and their families, and how we can be targeting the lower income populations with health services, if there's a way UNICEF is doing that through healthcare.
Thank you. And yes, mental health and psychosocial issues amongst children is indeed a big concern in these times. And so what we have been doing is both studying the various ways in which there is additional stress on children and trying to address them. I'm not the best person to be answering this. Should have had one of my child protection colleagues with me, but just to give an example, because of the guidance on isolation and quarantine, there were reports from several countries on children being separated from their primary caregiver, or children who had to be isolated were being isolated in absence of any close family member. So there was guidance produced on how to make sure that isolation and quarantine, when it's about younger children, is done in a certain way. I'm happy to share those guidelines after this training as well. And then the partners working on adolescent health have also identified significant mental health issues amongst younger adolescents, and so there have been significant efforts in engaging adolescents through be it Rapid Pro or other platforms that are available, to have support available through groups and on one-on-one as well. There are, I think, a few other guidance produced as well and disseminated. I'm just not very well aware of it, but I'm happy to share it later on. The second part of the question, one of the reasons that we continue to focus so much on community-based health service delivery is because in low-income settings, even in the best of situations, a large proportion of the population is unable to have access to the health facilities. You know, those 5 aspects to access to health services that we talk about: affordability, acceptability, etc. If you look at all 5 of those, even in best situations in low-income countries, half the population may not have access to health services. And we feel that the solution is community health workers that are within the communities, are well-trained, have the trust of the community, and are able to provide at least basic services at the community level while referring those that need to be referred. It works for everyone, the community, the health workers, and the health facilities. And so we've learned during COVID as well that countries that have community health networks have done better than the ones that don't, both in terms of community engagement and building trust and making sure that communities are aware and are utilizing the preventive measures. And so that's going to continue to be an area of focus for us, both for primary health care, but also for emergencies. And then the poorest of the poor, there are significant efforts for humanitarian cash transfers that are non-conditional to be implemented. It's easier said than done. There are so many political and other sensitivities around that. But in countries that already have established systems for cash transfers, in times of emergencies, it's relatively easy to use those same systems and make sure that the poorest of the poor are receiving cash transfers, and in some cases are at least receiving food baskets so that they're able to not fall into food insecurity.
Thank you very much, Dr. Shafiq. Thank you, Ms. Lochka. Thank you, Dr. Sinha. On behalf of the American Academy of Pediatrics and our panelists today, I thank you all for taking the time to join us on this webinar. This has been a very informative session for me, and I believe for you all as well. I'm sorry we're finishing a couple of minutes behind our schedule, but I hope that we can continue this conversation. And if there are any questions that we've not addressed in full detail, please feel free to send us an email, and we would be following up with some participants directly as well. As was mentioned at the beginning, this is the first in a series of webinars organized by the American Academy of Pediatrics, and we are advertising the next webinar right now. It's on providing pediatric care while parenting. So it's targeted at pediatricians, and it's going to help us explore when the Venn diagram of work and family collapses and how we get to do that successfully as parents. We have a distinguished lineup of panelists that will be joining us next week, Tuesday, for this. So please register for that event as well. And we look forward to seeing you on our next webinar. Thank you all for your participation. Thank you for your questions. Thank you to our panelists. Stay safe and continue to do the good work you're doing in your various regions and countries.